let's take a look at what is possible if enough vaccine supplies are provided to the states. And Andhra Pradesh on Sunday set a new record by administering over 13 lakh doses of the COVID vaccine till 8 p.m. Yesterday. And in the process, the state also crossed the 1 crore mark in vaccinating people with the first dose. Let's go across to Uma, who has a special guest. And Uma, quite an achievement. And it just shows that if, the states are provided with enough vaccines and if they really, put their mind to it, we can achieve really quick vaccinations.
Yes, indeed, Gargi. Stupendous effort on the part of Andhra Pradesh, which has managed to do 50% of the total vaccinations that happened in the country yesterday. We are on a special vaccine drive, and Andhra Pradesh managed those kind of numbers with a huge amount of manpower that was put to use on the ground. I am in fact joined by Andhra Pradesh Health Secretary, Mr. Anil Kumar Singhal. Mr. Singhal, good morning to you, and thank you for joining us. Many congratulations, first of all. This is a tremendous effort on the part of Andhra Pradesh healthcare infrastructure with the partnership of several others, I'm sure. How did you manage this? What are the kind of lessons that you are giving to the rest of the country?
Thank you, Uma. At the outset, I would like to inform everybody that the vision of the Honorable Chief Minister that we should set our targets high, and in fact he has been motivating us to achieve at least 10 lakh per day. The whole reason behind this is that for last year plus, the entire medical department, the field workers, they have been working very hard. And nothing motivates a person than his success, which is talked about at the national level. So this kind of effort, while we could have easily vaccinated the same 13 lakh people over a period of 3 days, but as you are aware, if you were to regularly administer 3 to 4 lakh people vaccines per day, and in case you are able to achieve 10 or 15 lakhs on a single day, then it makes the routine task of vaccinating 3 to 4 lakh much simpler. The first time we achieved our target of around 6.3 lakh, that was on 14th April, when the last time the Honorable Prime Minister had given a call for a vaccination drive. And that time the 6.3 lakh was achieved till late evening. And yesterday when we wanted to achieve around 10 lakh plus, the 6 lakhs was achieved by lunchtime itself. So on the whole, if we were to have enough vaccines and we were to vaccinate 3 to 4 lakh people per day to achieve around 1 crore of vaccinations in a month, it would make the task much simpler. And as a result, now for us, 3 to 4 lakh is absolutely routine. In yesterday's drive, as per the instructions of the Honorable Chief Minister, we started vaccination at around 4,589 centers, with around 28,917 staff deployed all over these centers. Now, what we need to appreciate is in the state of Andhra Pradesh, possibly unlike most other states, we have a huge army of foot soldiers in the name of village and ward secretariats, which we have established, where we have volunteers for 50 households at the rate of 1 volunteer each. So these 15,000 odd village secretariats, which were established by the government in the year 2019, and this huge army of 2.66 lakh volunteers who look after 50 households each on a regular basis for all government departments are a huge army available to me to be able to communicate our vaccination drive with the public.
Yeah.
So when we got vaccines to the tune of 9 lakhs on Thursday evening, we had almost around 70,000-80,000 vaccine stock available with us. So we thought possibly 10 lakh is an achievable thing, which we should try and do it on Sunday. So Friday and Saturday, all these volunteers, we do a line listing of all the eligible people available in that area of that volunteer, prepare the list. The volunteer goes house to house, intimating people of this vaccination drive, and then motivates them to come forward for the vaccination. So it takes care of any little bit vaccine hesitancy that is still left over, enables people to come, and then somewhere around lunchtime, again we take stock of who all have turned up, who are yet to turn up. Again, the volunteer takes those residual lists and goes back to the people and motivates them to come post-lunch. So this is how we organize the drive, Uma.
Okay. That's a great story to share with the rest of the country, and something that's worth emulating in other states as well. Of course, the limitations could be the vaccine supplies, which hopefully will happen. Thank you so much, Mr. Singhal, for joining us.